Hello, welcome to activity number 8, Intrahospital Epidemiological Investigation, and we are going to start first with important concepts of hospital epidemiology. First, we have epidemiology, that is the study of the distribution and determinants of health-related states in specific populations and the application of this study to control health problems. Then we have hospital epidemiology, that studies the causes of the appearance, propagation, and maintenance of health problems in the hospital population to prevent and control them. Then we have epidemiological investigation, that is to identify cases of healthcare-associated infections, their sources of origin and transmission routes. And then we have the nosocomial infection concept, that is an infection that occurs in a patient during care in a hospital or other healthcare facility. Then we have hospital infection, that is a localized condition that results from an adverse reaction to the presence of an infectious agent or its toxins, and that there is no evidence that it was present at the time of admission to the hospital. Then we have epidemiological surveillance, that is the organization and conduct of collection, analysis and interpretation of information regarding risks and damage to health. In its pillars are to collect, process, analyze, interpret, and disseminate. Then we have hospital infections that can be either endemic or epidemic. Endemic refers to the frequency of cases in a defined population in a given period of time. And epidemic refers to aggregation of a type of disease in time or space in number greater than expected. And then we have the most used indices that are global hospital infection indices. That include cumulative incidence indices, incidence rate, and hospital infection ratio. And then we have prevalence, that is a proportion of diseased individuals in a population at a given time. And then we have cumulative incidence, that is individual risk of becoming ill. Incidence density, that is the speed with which a certain disease appears in a population. Then we have attack rate, that is the number of new infections divided by the total number of exposed susceptibles. And communicable disease, that is the disease caused by a specific agent or its toxic products. And finally, we have the epidemiological chain of elements that are microorganism, source of infection, that can be a reservoir or environment, exit entry point or door, and direct or indirect transmission mechanisms, and susceptible hosts.
Now let's talk about important concepts of outbreak study. Nosocomial origin outbreak is increasing the number of cases observed for this type of infection compared to the expected frequency in a certain service within a specific period of time. Epidemic is a significant increase in the rates of infections associated with health in the period when compared with endemic rates. And an outbreak of healthcare-associated infections is defined as the occurrence of an unusual number of cases of infections that are due to a specific infectious agent or type of procedure. The main objective of an outbreak investigation is to prevent or avoid the spread of the outbreak to other hospital services, to other hospitals, or the community. To establish whether there is an epidemic outbreak, it is necessary to know the endemic of the service or the hospital. It means good data recording systems, and then calculate incidence rate, prevalence rates, and attack rates, and then compare the attack rate with the base frequency of occurrence. Other concepts are case, that is an individual in a population or group recognized as having a particular disease or condition under investigation or study. Index case is the first case to be recognized in a series of transmission from an agent in a host population. And contact is an exposed individual who may have been infected through transmission from another host or from the environment. Any communicable disease outbreak may be certified as closed once the maximum incubation period of the disease has elapsed without new cases having been presented.
An outbreak of hospital-acquired Pseudomonas aeruginosa infection caused by contaminated water. In the intensive care units, water is a typical source of outbreak of infections. By microbial pathogens, the CDC recommended to use sterile water, humidifiers for drinking, and oral hygiene. Aeruginosa is among the most feared pathogens associated with nosocomial infections. This has been associated with mortality rates of 14%. They have resistance for multiple antibiotics. They especially have outbreaks ICUs patients who presented tracheal secretions, proteins IC elevated, wounds, fever, or symptomatic inflammation. Gas exchange and clinical deterioration were considered infected. Patients with a chance for systematic infection were colonized and reviewed for 24 weeks. Material epidemiology investigation cases were identified by reading records clinical, microbiological records, culture, microbial data.
So the results are that they found that at day 1, 5 patients with pseudomonas in solids have been detected or with the MICU within the prediction of 11 days, and infection control service was informed. At day 3, 2 further patients were found to be positive, so pseudomonas, and at day 4, the slow days from the 5 of 7 patients were found to be medically investigable. So at day 7, a thorough screening program was undertaken, which included a taking of 103 samples from numerous sites of the animate environment. 3 of the 4 symptom samples, 2 further patients, and 1 bottle of mineral water were positive of pseudomonas. So that's very important to have in mind. And at day 11, finally, molecular typing revealed that is loaded from the first 5 patients. The 2 screening patients and the mineral water samples were genetically investigable. So that's one of the results, one of the more important results. So, and the discussion, this hospital-wide outbreak of Pseudomonas infections, colonizations was associated with a single contaminated bath of BSW as confirmed by the microbiological epidemiological findings. And genetically indistinguishably isolated pseudomonas were obtained from 19 defected colonized ICU patients. And following examinations of multiple samples from the environment in the ICU with only pseudomonas from the BSW was genetically identical to the outbreak stain. That's what I already told you by the results. And 2 weeks after removing the BSW from the ICUs, the number of infections and colonizations with pseudomonas shows a statistically significant decrease. So that's one of the most important results. And here you have our reference. Thank you.